Okay.
So what we have today is a theory presentation regarding Hildegard Peplau. So Hildegard Peplau is born in September 1, 1909 in Reading, Pennsylvania. She graduated from Pottstown, Pennsylvania School of Nursing in 1931 and worked as a staff nurse in Pennsylvania and New York City. In 1943, she earned her bachelor's degree in interpersonal psychology. She also earned her master's degree and doctoral degrees from Teachers College, Columbia University in 1947. She also served as an Army Corps nurse and the American School of Military Psychiatry between 1943 and 1945. She is also the first nursing theorist since Florence Nightingale. Hildegard Peplau is known as the mother of psychiatric nursing. She is a professor at Rutgers University from 1955 to 1975. She also became an advisor to the World Health Organization, and she also served as a consultant to the U.S. Surgeon General, the U.S. Air Force, and the National Institute of Mental Health. She was the only American nurse who served the American Nurse Association as executive director and later as president. After retirement from Rutgers, she served as a visiting professor at the University of Leuven in Belgium in 1975 and 1976. She died in her home in 1999 at Sherman's Oak, California. So, which organization did Peplau lead as president? A, Dean of Nursing at Rutgers University. B, the American Nursing Association. C, lead nurse in the School of Military Psychiatry. Or D, World Health Organization. Any clue? The answer is B, the American Nursing Association. So what are the major writings of Hildegard Peplau? She wrote The Interpersonal Relations in Nursing, a conceptual frame of reference for psychodynamic nursing. She also wrote The Interpersonal Theory in Nursing Practice, selected work of Hildegard E. Peplau. She also wrote A Glance Back in Time Nurse-Doctor Relationship, Psychiatric Nurse Accountable to Whom for What, Psychotherapeutic Strategies, and Peplau Theory of Interpersonal Relations.
All right, this is just a little chart that shows Peplau's theory of interpersonal relationships. And it kind of shows how the overlap of the nurse and the patient's point of view and how that creates a therapeutic relationship. So some major concepts, propositions, and relationships. She began to form her theory on interpersonal relationships when she was working in a private psychiatric hospital. And she is known for her book, which we previously mentioned, The Interpersonal Relationships in Nursing. And the interpersonal relationship theory has 4 different phases, and those are orientation, identification, exploitation, and resolution. And she also adds with that theory that there are 7 different roles that the nurse takes on. Stranger, resource, teacher, surrogate, counseling, active leadership, and a technical expert. And I also attached a web page there that shows some of her works. Ooh. All right, so the different parts of the interpersonal relations theory is that there is a person or a man. So this is a person who is striving to meet their physical and psychological needs. And the main point of that is that they're trying to reduce anxiety by any means that they can. And then also Peplau's view of health is a little different. She said that it's a symbol which describes the ongoing processes of a person in terms of their personality, productivity, and overall living instead of just their physical health. And she wanted nurses to consider the culture or environment that the patient is in because that can have a big influence on their health, especially when you consider it in terms of like the way that she viewed health. And then nursing is a therapeutic relationship between a person and a professional who is trained to assist them. And then the therapeutic relationship for nurse and client is the nurse assisting the patient with their problems. So the steps of the interpersonal theory are orientation, identification, exploitation, and resolution. So the orientation phase is when the nurse engages the client and begins the question of defining the problem, establishing the relationship, asking questions. The patient might have questions about something and then the nurse will answer them. So that's kind of the beginning of the relationship. And then in identification, the patient begins to show more independence and they want to like make their illness better with the assistance of the nurse. So this is a lot of nurse education for the patient. And then exploitation is the patient uses services from the hospital to diagnose and treat their problems. This stage is like for behavior modification for the patient, and that's what the nurse is hoping will happen. And then the resolution stage is when the patient no longer needs nurse assistance and they are considered to be recovered from whatever illness they had. Which stage of interpersonal theory involves the patient taking control? A, orientation, B, identification, C, exploitation, or D, resolution? The answer is B, identification, because that's when the patient starts to become more independent.
Okay, so this section was about Peplau's website and original work. I was able to locate some of her original work, which was a journal article that was about her interpersonal relations theory. And then she also has a website dedicated to her, and it includes her background information and other links to her works and her contributions to nursing. And also on her website, there was a message that was directly from Peplau, and it is nursing has made great progress from being an occupation to becoming a profession in the 20th century. As the 21st century approaches, further progress will be reported and recorded in cyberspace, the internet being one conduit for that, linking nurses and their information and knowledge across borders around the world will surely advance the profession of nursing much more rapidly in the next century.
So Peplau's theories are still being used in research because they are focused on patient experiences in nursing care, and that's an important concept in lots of different things. So her theory has been influential, but it has been overshadowed by more scientific approaches to nursing. Some researchers argue that nurses should focus again on the basic concept of nursing relationships in their practice. Maybe many nurses follow Peplau's theory of interpersonal relationships in their practice, and it can be useful in general care as well as psychiatric care, which was her focus.
So, as Caitlin just said, she was a huge advocate for the improvement on psychiatric nursing as a whole, and she also essentially created the concept of patient-centered care, which I think is really important. She described patients' personal experiences and values as the most important thing to learn from a nurse's perspective in order to prove the best evidence-based care. She wanted to enforce the focus of nursing research and that it must begin with patients, with their individual needs and desires, therefore their overall perceptions on specific care that they receive from their nurses. She actually created this survey that patients can fill out in most hospitals today. It's known as the Consumer Assessment of Healthcare Providers and Systems Hospital Survey, or HCA-HPS, and the purpose is pretty obvious as it sounds. The purpose of the survey was to use public patient reporting for patient experience data that would allow future patients to compare their scores and make better informed decisions about their future care and future hospital admissions. And then this feedback also allowed hospitals to seek out their own strengths and weaknesses with their workers.
All right, so Hildegard is no longer alive, obviously, as we stated, but she is still remembered as being the mother of psychiatric nursing to many people, and she established modern day psychiatric nursing with the way that she viewed patient-nursing relationships. And her impact continues through a research fund and the fact that interpersonal relationship theory continues to be studied and that people continue to look at it. And the whole concept that she created of patient-nurse relationships is applicable in our everyday clinical setting because we'll always be directly caring for patients. So it's always good to consider that. And here is our references.